This is Ed Briggs, professor in NUR520, and this brief little video basically is intended to help you perform a better analysis of a health policy issue or piece of legislation. Now, anytime we talk about legislation or a health policy issue, we're really talking about the interaction between multiple different factors. So any health policy, piece of legislation or issue is going to cover more than just healthcare. It's going to look at economics, it's going to look at social policy, it's going to look at religion, it's going to look at politics, and it's going to look at healthcare delivery. So when we look at a health policy issue, there are multiple factors we need to consider. And when we do an analysis of these issues, we also need to take into consideration these different factors. Now, first piece of guidance I would give you is that if you're trying to find a bill or a piece of legislation, you can go to the Florida House or the Florida Senate, and at the top of the web page you'll see bills. You can click on bills and then do a search looking for different subject matter or different bills. What will come up is a summary of the bills, and you can then click to see the actual text. But in most instances, the summary of the bill will give you the majority of the information you'll need for a discussion. If you're looking for a federal bill, you can go to govtrack.us and then click on Find a Bill, and you can do a search based on subject looking for different bills. And again, they will give you a summary, but they will also give you access to the entire text of the bill. In most instances, like I said, the summary is enough because the actual bill will be several hundred pages, several hundred lines long, and could be dozens of pages. So let me give you an example, and I want to stress that this is only an example. This is not an actual bill. It's just an example bill to kind of give you something to think about. With all the news of poor care within the VA, U.S. Senator X has presented a bill to Congress that would dissolve the VA over the next 10 years. He claims that by doing this, veterans will have increased access to care, they'll have improved outcomes, they'll have improved satisfaction, and there will be a cost savings to the nation. He proposes shifting all veterans to a new Medicare Part V, which would allow veterans to buy health insurance through a select list of providers. Again, this is only an example, it's not an actual bill.